I got to tell you, I'm a little bit nervous about this. I have, we talk about stigma, and we talk about, how willing are we to throw up our hands and admit, that we have a history, and quite frankly, part of that is because even in the medical profession, there are those that in the medical profession that don't understand what it is that we do. At an early age, I sought to self-medicate, and I got into things pretty hard and deep, and left home at 15 years old. I was going to show my parents in the world that I could do this and I could make it on my own. I spent a number of years doing that thing where around age 28 or so, I was living in my car. I was pretty much homeless. I had run everybody out of my life that had mattered. Family. I don't want to get into details about what happened, but I can tell you that I've been clean and sober since August 25th, 1988. And that path, led me down. I worked for 6 years in a substance abuse treatment center. It was there that I decided that I wanted to go back to school. I was reading an article in the New England Journal of Medicine about how there wasn't enough folks in the mental health profession that had lived experience, that had that background, that experience, that had the level of education. So I started going down the path. I wanted to become a licensed clinical social worker somewhere along in there. Changed paths and decided to go to nursing school, and then from there, obviously, went on to get a graduate degree in psychiatric mental health nursing. If you'd have told me 30 years ago that I'd be doing what I'm doing now, and have the level of success, and be able to give back and understand and work with this population, I'd have told you were crazy. That there was no way a person like me was ever going to amount to anything. I mean, that's pretty much what I'd been told and had proven to myself over the years, to that point. But it was extremely difficult. I didn't know if I'd burned out too many brain cells, if I was going to be able to make it through school. And frankly, it was tough. It was not an easy thing to do. But today I have the opportunity to work with this population and hopefully influence what it is that we do each and every day to try and make our mental health system better. And that is my passion. That's what I love. And this, you talk about what would you do if you didn't get paid for it? This is it. This is what I would do. So I know I'm in the right place doing the right thing. I want to get off again. It's largely the same thing. It's around the stigma. I think about how very easily society discards folks with mental illness and substance use disorders. We see them. We pass value judgments on them. Even those of us in the medical field oftentimes can get exasperated with patients that we work with. And always bringing it back to remembering that, we can't throw these people away. We don't know who we're dealing with. I think about that I was almost thrown away, and if it hadn't been for some very fortuitous events that happened in my life and some very generous people that reached out to help me when I couldn't help myself. One of the things they told me early on in recovery is we're going to love you until you learn to love yourself. It took, there was quite a few years of therapy in there as well, and continue to stay very close to the recovery support that I have. I don't think that I would be able to do what I do without that. But thinking about when I see a patient in the hospital, younger person that's going through what appears to be some of the same things that that we've all gone through, and I think there's hope. There's hope for every single one of these people. That, if they're struggling with their illness, their disorders in a way that they deserve to have the opportunity to have a quality of life. I'm very fortunate to have had doors open for me that opened, and that may not be everyone else's experience, but being ready and willing to walk to those doors when they did open, but offering those same opportunities to these folks that are out there suffering. We're not defective, very capable. Most of us, probably above average as far as intelligence and things like that go. But it's not what I was taught growing up in the faith that I was brought up in. It's not the right thing to do. you don't treat people that way, you know. And basically it comes back to, you know, I'm going to love them till they learn to love themselves, you know. I've got to give that back. I have to.